Good afternoon, everyone, and welcome to today's COVID-19 update briefing. In the battle against COVID-19, Illinois has set a few records in the last few days. Records that have established our state once again as one of the best performing states in the nation. Over the weekend, we reported more than 74,000 tests in a one-day period, a new high. We're now averaging over 52,000 tests each day, among the top testing states in the nation. And we are one of the first states to surpass 5 million tests since the onset of this pandemic. At this point, we are by far the best testing state in the Midwest and the best testing state between the two coasts. Why is this important? Because those accomplishments contribute mightily to our ability to monitor and squash the spread of the virus in our communities. Together with targeted mitigations, our testing leadership means that Illinois has had the lowest positivity rate among all of our neighboring states for the last few months. And with Region 4 and Region 7 reducing their infection rates substantially, we have seen positivity rates decline in 8 of our 11 regions over the last week alone. That said, one of our regions, Region 1 in northern Illinois, which includes Rockford, Dixon, and Galena, has continued to climb toward the 8% threshold at a concerning rate, now sitting at a 7-day average of 7.5% as of today's data. IDPH has reached out to county health officials to discuss preventative measures that can be taken at the local level to avoid additional mitigations in their communities. To area residents in Region 1, please wear your masks. Encourage others to wear masks. Watch your distance, wash your hands, and get your flu shot now to make sure that if you get COVID-19, it won't be much worse than it otherwise could be. You don't have to take my word for the fact that you can lower your positivity rate. Just look at Region 7, that's Will and Kankakee counties, which brought their positivity rate average down and were able to return to the Phase 4 mitigations of our Restore Illinois plan last Friday. That region is now sitting at a 5.7% average. Or look at Region 4, Metro East. After reaching a positivity rate as high as 10%, and despite bordering Missouri, which has a 12% positivity rate, Region 4 has brought its average down to 7.3% as of today. They may be on their way down to 6.5% and a removal of regional mitigations. We're all rooting for Metro East. You're so close and you're heading in the right direction, and I'm hopeful that local law enforcement, local elected officials, and local public health officials will work together to help enforce the guidance on capacity limits and encouraging masking and distancing. Our state is among the best in class when it comes to fighting COVID-19 because we've put people first. We've made sure that tests and treatment are available to anyone who needs them. We've worked to protect Illinoisans from the worst effects of the financial downturn, and we've consistently encouraged the mitigation efforts that we know work. And that's masks, of course, distancing, and hand washing. And it's with those same tools that we'll find our way out of this pandemic and through this difficult time. So thank you, and with that, I'd like to turn it over to Dr. Ngozi Ezike, the Director of our Department of Public Health. Doctor.
Thank you, sir. So good afternoon. We continue to see good testing numbers in Illinois. In the last 24 hours, 46,391 labs were reported for a total of 5,231,607 tests. Today, we are reporting 1,848 new cases of COVID-19 for a total of 279,114 confirmed cases. I need to add here that these 1,848 individuals that were diagnosed with COVID did not choose to get COVID. They didn't want to get COVID. They are not bad people for catching the virus. We need not point fingers or vilify people who test positive. Truly, we should actually be thanking everyone because they went and got a test. And we especially want to thank them for staying home and being isolated while they have this virus. Some people have become a bit numb to the numbers, but I want to remind people that COVID-19 can have severe consequences, definitely in the short run and to be seen in the long run. Since yesterday, we've lost an additional 22 lives. That brings our total to 8,508. 1,563 people in Illinois were reported to be in the hospital overnight with COVID-19, and of those, 351 patients were in the ICU, and 144 patients were on ventilators. Until there is a vaccine, your mask and social distancing are your best protection against COVID-19. As always, keep wearing those masks. Watch your distance and wash your hands. And I'm going to add this every time as well. Please get your flu shot. Thank you. Gracias al gobernador por su liderazgo durante estos tiempos difíciles. Seguimos viendo buenos números de pruebas en Illinois. Hoy informamos 1,848 casos nuevos de COVID-19 aquí en Illinois para un total de más de 279,000 casos confirmados. Debo decir aquí que estas personas no querían enfermarse con COVID-19. No debemos ser malos y tratar a estas personas de manera diferente. Realmente debemos agradecer a cada uno de ellos para hacerse una prueba y especialmente agradecer por permanecer aislado para que otros no se infecten. Algunas personas se han vuelto un poco insensibles a los números, pero quiero recordarle a la gente que COVID-19 puede ser mortal. Desde ayer hemos perdido 22 vidas adicionales para un total de más de 1,800 muertes. Se informó que 1,563 personas en Illinois estuvieron en el hospital durante la noche con COVID-19. De ellos, 351 personas estaban en la unidad de cuidados intensivos y 144 pacientes estaban en ventiladores. Hasta que haya una vacuna, su máscara y distanciamiento social son su mejor protección contra COVID-19. Como siempre, use su máscara, cuide su distancia y lávese las manos. Y voy a pedir esto cada vez, por favor. Vaya a obtener su vacuna contra la influenza. Gracias. And with that, I will turn it over to Governor Pritzker.
Thank you, Doctor. Happy to take questions from members of the media. Sarah? Yeah.
Yeah, Brianna Taylor, at 12:30, they're going to announce whether or not the police officers are going to be charged
Yes.
in her death. What have you done to prepare in the city of Chicago and the state in case there's some civil unrest?
Sure. Well, first of all, as always, I've been working with our municipal leaders. I've spoken with mayors throughout the state and met with the mayor of Chicago yesterday morning. We have all along had plans in place to be supportive to our municipalities with both state police and potentially National Guard. And so we've got the National Guard at a state of readiness. We have our state police alerted that there may be a decision that will come down 12:30 our time, and so we're preparing as best we can for the idea that there may be peaceful protests or something beyond that.
Was Mayor Lightfoot receptive towards the National Guard? She hasn't been in the past.
Yeah, I think that's not an accurate way to depict the discussions about this. I think she has always been of the opinion that we shouldn't bring the National Guard unless they're needed, and I think that's the right way to think about it. So she's been careful about when she's wanted to call the state and ask for help from the National Guard. We have the same mindset, I think, about this, which is we want to make sure that we're keeping the people of Chicago, and of course I have responsibility for the other municipalities all across our state, and so do state police, and so do the National Guard. And so we're working together hand in hand to make sure that we bring the right resources in the event that we need them.
A question from Telemundo on this issue.
Yes.
Saying, do you have a message for Illinois residents as we await this decision?
I think I'm hopeful that the decisions that are made in this case are ones that take into account the terrible circumstances that occurred here, that Breonna Taylor was innocent, that she was gunned down in her own home, she was unarmed. This is it's one of these circumstances that I think is upsetting to almost anybody that looks at what happened here. And so, having said that, I await the decision. I don't know which way it will come down, but I know that we all pray for her family, and of course, I think we all grieve for the loss of an innocent young woman.
What's your message, though, to people out there that if the decision goes one way or not favorable, what's your message to those out there that may take the streets?
Well, depending on how this comes out, I think for anybody who would take to the streets, I would suggest that we will protect their right to free speech. We will protect their right to protest. But we will also stand against anyone who is intending to loot or intending to cause violence or to cause mayhem. And I'm hopeful that everybody will listen to that. But I'm awaiting the decision that comes down in Louisville with, some concern, and of course with uppermost in my mind keeping the people of Illinois safe.
Okay, a lot of IHSA directors are saying that, now that our positivity rate is low compared to other states, which is good news, that's good news, is it a time to let states go back to playing high school football, soccer, and girls volleyball?
Well, I appreciate your asking about that, and I know that every day you've asked about that, and I know that's of great concern to you personally too.
A lot of people in the state.
Yeah, and I'm just saying I appreciate you asking it, and I let me begin by saying that as you know, many sports are being played and are allowed this fall. At baseball, for example, softball, tennis, fishing, swimming, cross-country, track, many others. There are many others. And I think it's important for people to recognize that the sports that aren't being played this fall have been moved to the spring. It's not that we've said you can't play them, but they're not being played this fall because the doctors have said that the high-contact sports, the ones that pose the most risk of transmitting COVID-19, shouldn't be played right now. And so having said that, we're working hard to keep our children, keep their families safe, to make sure that we're not getting this virus transmitted. My number one priority here is to make sure that we could allow in-school learning and not add other dangerous activities on top of what already would be, some risk that would be taken by those who will go back into the classroom. We want people to go back into the classroom, and that's the high priority.
Everybody wants that.
Yes.
What's the metric going to be, though? I talked about
Yeah.
Governor Cuomo, his 2% positivity rate and under.
Yep, yeah.
In-person learning. I
Yep.
know you've left it up to superintendents all over the state. I think that's a good thing, but is there going to be a point in time when you have to stand up and say, let's get back to class?
As I said to you,
We don't have too much power, and I don't think we're ever going to go back.
as I said to you before, I would love it if we could get below 2%. That would be terrific. We are not anywhere near that right now. And what has happened is that Illinois, even though we've got the best positivity rate among all of our neighboring states, it's still a concerning positivity rate. And you just heard me talk about a particular region that's heading in the wrong direction. We've got another one that's still under additional resurgence mitigations. And there really isn't anywhere in the state that has met what you've described as the New York model, the 2%. As we move in that direction, if we can move in that direction, right now we're about steady. We've moved down some, but over the last few days, the 7-day positivity average has been about steady at about 3.5, 3.6. And I'm focused on just bringing those numbers down. But again, as I have said to you time and time again, our schools are a priority. We want to make sure that kids are back in school. There are many kids who are in hybrid programs and many kids who are not at all in school. They're just in e-learning. And the further we can drive this positivity rate down, the more I'm looking forward to the idea that kids will be able to get back in school.
Dr. I have a question on unemployment.
Yeah.
A man just filed a lawsuit claiming that a glitch within the state system prevented him from getting thousands of dollars in benefits. He says he was forced to file this legal action against the state because IDES just isn't responsive. What do you say to that?
I don't know about the particular lawsuit, and I really can't comment about pending legal matters.
You say we're the best testing state. So do you see a time where we can get every kid tested so they can get back to school on a regular basis? I mean, because it could take forever for that positivity rate to get down to 2%.
Well, it's happened in other states. It's not, when you say forever.
We're not talking about the next month or.
We were at one time, as you know, this summer down to 2.6% positivity. And unfortunately, what we've seen is there are certain places, certain types of activities that have caused more outbreaks than other types of activity. And they've happened more in certain regions than others. And those activities and those regions have driven the entire state up. We're now trying to bring it back down again. Remember, we're weighing a lot of things in the mix here, but here's my number one concern, and that is we have lost 8,500 lives in this state. And literally tens of thousands of people have become seriously ill and continue to have problems with COVID-19 even if they've recovered. And so my number one concern is just preserving life, preserving people's health, and trying to balance the interests that we all have. Again, highest on that priority list is making sure that we can keep our economy moving and putting kids back in school.
You mentioned the lives lost here in Illinois. We just, of course, passed 200,000 as a nation. Do you think people are becoming numb to these numbers? And are you worried, especially as we moved into the colder months, when now is the time to really get this under control, according to most health experts?
Look, I think, yes, I mean, the sheer numbers are just almost hard to imagine, right? This is like all the people who died in World War II, right? I mean, it's an unimaginable number. And it is weighing on people that they just can't, it's almost that people don't want to deal with that number. It's so big. I do think, though, that it's not that they're ignoring the virus because of the big number. I think what you're seeing is more and more people who know somebody who either died from the virus or got sick from the virus and is still suffering from it. And as that happens to people even who've been denying that they should wear a mask and denying that this is a real disease, I think those people have changed their minds, many of them. They've come to understand that when it's somebody close to you or somebody you know that has died or gotten significantly ill, that has an effect on how you feel about it and whether you think it's real. And so unfortunately, as the numbers grow, maybe people aren't focusing as much on how big that number is, but they are focusing on the fact that they know somebody in their community who's suffered from it.
Do you want to comment on Gail Sayers?
I do. Look, I grew up a fan of actually, in particular, of Gail Sayers. And I just, there are a few people in sports history that truly, I think everyone who loves the sport, particularly of football, looks up to and thinks of as a hero in the sport. And Gail Sayers is one of them. And so I'll have more to say about him because I do feel deeply a loss of somebody who played for a team and loved the sport and was a hero to so many. But I just want to express to his family and to all of his friends and frankly to all of the fans out there, my sorrow, my condolences.
Speaking of football, former NFL linebacker John Polchuk, he graduated from Marian Catholic, now coaches at Loyola Academy. He has invited you to come check out one of their practices, meet some of the parents and some of the kids. Would you be willing to do that as you?
I've been to many football games. I've met a lot of parents and high schoolers. I appreciate the invitation. You know, always happy to get an invitation like that, but I can't tell you whether I could visit that or not. It's, you know, we're pretty busy with a few other things you've heard me talk about today and over the last 6 months. But look, I understand that he's somebody who would want to use that circumstance to try to convince me of something. And let me be clear. I am listening to the experts. There is not something, I do not know I was not the one who decided that swimming ought to be something that gets played, cross country meets run. I'm listening to the experts, and what they're telling me is that football, a high contact sport, is more dangerous than other sports, and that's why they'll be able to play in the spring. Hopefully because we'll have more treatments available, and I think we're all praying that we'll have a vaccine.
So you can say that with 100% certainty that we'll play in the spring?
Like I said, with the hope that there are greater treatments and a vaccine. I think we all are praying for that. That's one of the reasons why postponement made sense.
I'm sorry.
Yeah, that's okay.
Sports-related question.
So you don't have to apologize.
Your daughter has been involved in.
I didn't hear what you said.
There are reports that your daughter has been involved in equestrian events during this. Again, sorry to ask about family members, but do you have a response to people saying that that's hypocritical while other sports are not allowed?
Well, let me begin by saying that attacking my daughter for playing in a sport that is allowed, that the doctors have said that people can play this fall, is something that I think people need to recognize is inappropriate. Bringing our family members into politics, inappropriate. The fact that people protested in front of a state employee's house over the last few days, scaring their children, creating an awful circumstance for them. I mean, that's very inappropriate. And I think that people have to understand that what I'm focused on, again, with all of this is saving lives, is making sure that we're keeping people healthy. The fact that people want to get personal is disturbing in the context of the fact that people are dying. Maybe people ought to step back a little, ask themselves, what is this all about?
All right, thank you, everyone.
Thank you.
Employees.